separating the right and the left, up and down. All this is the network of lymphatic vessels. That's why if you ever come and see us do, that's why you see, why am I doing the good side first, instead of straight away go to the left side, go to the swollen side. Because what we're doing is, we are opening all the channel first, and then we drain little by little the fluid. Sometimes if the condition is still new, even by opening the channel, you can slowly see the fluid also flow. It's just that sometimes with the like breast cancer or cervical cancer or prostate cancer, they remove some of the lymph nodes. For breast cancer, they will always, there are 3 levels, sentinel. Usually the first and second, they remove the lymph nodes. It's because that they're scared that the cancer have gone to those lymph nodes. As you know, if the cancer have gone to the lymph nodes, it will spread to other organs and other parts of the body. This is, as you see the green one, is where the lymph fluid go back to the aorta, our blood vessels. That is, we call it the venous angle. We have the right and the left. That is how, when we massage, we stimulate, and then we have the biggest thoracic lymphatic vessels, we call a thoracic duct, is from T12 until L1. That is where the lymphatic vessel, that the biggest lymphatic vessel is. And that also, that lymphatic vessel, when we do breathing and any breathing exercise, it helps to like kena massage by the negative pressure in the abdomen. And it helps to bring out the fluid, go back to the aorta through this venous angle. And the thoracic duct and drainage quadrant is very surprisingly, if you have a left swelling, if it's not being done anything, not done, you can see slowly it go to the left leg, and then it will go to the right leg. But it will not go to the right side. That is the, I don't know what that is how the system is. The right side, it will only go up to your left, right side of the face, the back, and the body until here is like this. And then the back. But yeah, only 1/4 is the right side. But then if the left side can come here. But sometimes in certain cases also it can overflow to the other side. It doesn't mean it cannot. But for us if already gone to the other side, it will be very long time for us to do the massage. But also sometimes the swelling also can be too tight due to the lymphatic vessels and due to the circulatory. This is what I mean just now. Swelling. The lymphatic fluid is actually very clear, but when you touch it, it's like a bit sticky lah. But it's very clear, it's like water. If you look at it, it's like water, clear fluid. But it contains of water, it's high in protein, and it got blood cell, red blood cell, white blood cell, other waste product, and also fats. The lymph fluid in the small intestine is not clear. It's milky color because it contains the fat acid. This is the function of the lymphatic system. They remove the fluid from the tissue, and this take in return it into the blood vessels, and it's also transport protein, fat, and other molecules, and also immune cells too, and from the lymph nodes. That's why why when our patient have, like the patient is not well that day of having fever, we usually ask them to call us reappointment. As long as they are not well, because when we do this massage, we are stimulating the lymphatic vessels and then we are increasing the immunity. And if we do this massage, they might become, their fever or whatever illness become more. But some of my patients, they say, it's like when you're taking the one type of therapy, forgot already that, like you use toxin to counteract the toxin. But one name, forgot already. Homeopathic. That is something like that. But some of my patients, you know, they know that it will make them worse, but they say that the recovery rate like a bit faster than like now they're having flu. I do it usually because you wait can and they are mostly they are survivor, so I usually don't want them to make them more discomfort. So I ask them to come. Some of them say no problem because their recovery are faster, like the homeopathic, like they become worse on that day, the next day they will be much better. It shorten the disease, sort of shorten the illness time now. This is how, this is another overview how you see the lymphatic. This is the venous, the one, then the blood vessels with the oxygenated blood, and then the lymphatic vessels. They come together, and this, and then the difference between the vascular means the blood vessels, and then lymphatic vessels is, this is another how we see, there exists when the blood vessels become the thinnest. All but everything will go back to the heart. Another diagram how it is. And then this is the difference between the capillaries and then lymphatic capillaries. What you need to know is that the blood capillaries, they carry bloods. What the lymphatic is, they carry lymphatic vessels. And then for the lymphatic system is one way only. When the blood vessels become the thinnest, that where they exist is straight from there, it go back to the heart. It don't go around the body. Where else the blood circuitry from the heart go around the body to the heart. And the difference between the lymphatic system and blood circuitry is approximately 4 liters per day. Only 4 liters per day. That means how many meals per hour. Whereas the blood circuitry is 7,200 liters per day. So you know difference about 2.5 liters per hour like that. And for the lymphatic, like you know that it's like the bamboo, it's not a continuous flow. And like the blood vessel, it's a continuous flow. And the lymph, that means the lymph fluid is filtered by the lymph nodes, while the blood vessel is filtered by the kidney, the liver, and the spleen. And the difference between lymphatic, how do we know the difference between the patient have lymphedema or swelling or edema? The difference is lymphedema is it takes very long time to develop until you can visually see it swollen. But the patient can feel it when it becomes visually swollen, like they feel discomfort, like they are a bit tight, their sleeves. They say, hey, why my left side is a bit tight, but you see, no difference. And also, they feel a bit discomfort, a bit heavy. That is the stage 0. At that stage, or when they can see a little bit swollen, is the best one because with our massage, it can go back to normal. I have a few that have gone back to normal. But for those yang with stage 2 and stage 3, or the stage 3 is the elephantiasis, is one like that, but it's still much better than the big and bulky one. You will see a few pictures later lah. What is lymphedema? It's actually abnormal accumulation of protein-rich fluid. The difference between a swelling and lymphedema is the fluid. The fluid of lymphedema, if you take it out, it contains high in protein. That's why if we don't treat it, more fluid will come out from the blood vessels. Because like if you remember your science is process of osmosis. It's like you put in a big basin, you put a membrane, one high sugar or high salt and one is plain water, and then you will notice the water will go to the high sugar or high water. That is what happens because it's contained in high protein. This protein attracts the water. Whereas if it's a normal swelling, the fluid will be very low in protein. That's why for those swelling like you sprain your ankles, you injured yourself, even a bruise gun, you elevate it, you bandage it with a normal bandage, it goes subside very fast. Lymphedema will not subside even if you bandage it and elevate it. You need to open the channel. And if a compromised lymphatic system, there cannot reabsorb this protein-rich fluid. And like just now lah, to come it out, you need to do the manual lymphatic drainage. Sign or symptom is usually they start distally. Means at the hand or the foot. And then when you pick up in between, you cannot pick up the skin like this. You cannot pick up like this. You see your lymphedema if swollen. Yeah. But normal swelling you can still pick up. But lymphedema you cannot, no matter how you cannot like this. Pick it up. That is a sign of what we call it stenocyte positive. And it's speaking edema. And then you will see the toes like mini sausages, or the hand like sausages like that. And if both their hands or both their legs are swollen, but you will notice that one is bigger than the other. That is lymphedema. And if it's both the same, it's not lymphedema. It's edema. You will notice it if it's a lot of difference. And cellulitis, this infection of the tissue, is where is their enemies. Every time they have an attack of cellulitis, the swelling will become big, and it can, if not treated, it can lead to death because of sepsis. And it's an emergency. And when you see your patient, you have to tell them if they feel their limbs, that swollen limb, that are a bit pinkish. Even sometimes you can't hardly see the redness or pink in the beginning, but they feel unwell, they feel like they're coming down with flu, they feel their hand are aching, and then you touch it a bit warmer than the other side, is cellulitis. Send them to the casualty. Send them to the emergency. The doctor will know what to do. Sure, they will give them. Last time they will ward them for 2 weeks for IV antibiotics. But nowadays, if it's not severe, maybe in the casualty one time, and after that go discharge with tablet antibiotics. Sure will be 2 weeks one. And this is some of it. This is when you reach stage 3, that the skin are a bit not nice. Something like this. Papillomas is, I think, the skin, the vessel, they become. But keratosis is hardening, and then the papillomas like bumps all over the hand or legs. But you'll be surprised. With manual lymphatic drainage, all this can flatten. it can also, this swelling is too much, it can go down to the limbs, to the upper limbs. That's how we see lymphedema of the lower limb and upper limb. For this patient, actually he passed away not because of lymphedema, for other condition. He's actually is not a cancer patient. It's medical error. He had a fracture when he was young, around 9 or 10 years old. He was put on plating, but when he reached about 12 or 13, the plate poking at him. So they took it out. I don't know how when they took it out, suddenly he developed lymphedema. And you see the why this one like no skin, because he, under Suchi, they sponsor him to Taiwan, they do debulking surgery twice. When they do debulking surgery, the swelling come down. But after a year, it come back again. But actually, he's supposed to come back to us to follow up lah, to maintain it, it will not become so worse lah. As you know, debulking works for a year or so, but if it comes continuous for maintenance with us, it might sustain it, the swelling come down lah. But debulking, as you know, they are taking away the skin. And you know when they're taking away the skin until the fats, so until the muscle area. So you know your first layer and second layer of the lymphatic vessels already gone. So how does but then there are also microsurgery they can do, like you do for your blood vessels, like bypass. And that is, I think, Mr. Sejus does it, but he seldom do it because his microsurgery is very tedious and very fine. And this patient is due to nasopharyngeal carcinoma, is one of my patients. And this is, I forgot to take the before, this is the after. Actually both the legs are, like these are very hyperpigmented until the calf area. And after few treatment, it become like this one, and this one also lighter. This is due to varicose vein. And if for lymphedema that causes by blood vessels problem, is very fast recover. But if lymphedema, as in the lymphatic system itself, is a bit slow. This is because of the wounds, because varicose vein can also lead to wounds. And this is my recent case. This is, you see, actually, they don't know why he have lymphedema, but after asking him question, I think his lymphedema started with obesity. He was 130 kilograms before, so it's roughly about 500 pounds, 500 to 600 pounds. How obesity causes lymphedema? You know when you obese kan, your stomach so big kan? This skin text compresses on your, here got your vein, artery and nerve. And also here the groin got a lot of your lymphatic system. There's lymph nodes. It compresses on it. And then because of compressing on the, not only on the lymph nodes, the lymph vessels and also but also the blood vessels, that's why he developed this sore. This was very rare, except the thigh, only the lower leg. And all this, you see, both sides also got. After 1 week, I see, you see the difference? Here also become small. This leg is like this before, but now it's like this. 1 week. For daily except Saturday and Sunday. That one also I do it 4 days only because on 1 day I have something on I cannot treat him. But now he's 3, I have not taken his, I don't If my phone got or not? No, it's not painful. Not painful. Manual is, he's painful, but that treatment is not painful. He cannot walk. But after 1 month I did him, he able to walk like from here to the door. Let me see if I got.
Why he comes so late?
He came after on 13 years because the doctor don't know what wrong with him. He always, like every 2-3 months, he go to the ward because of cellulitis.
Oh, I see.
And then suddenly, because of this wound and of all this issue in the skin, they finally refer him to the dermatology. And Dr. Michelle said, this is a lymphatic problem. And then he was ended up in Queen 2. All this one I think he was in Queen 1. Ended up in Queen 2. The doctor there, because Queen 1, Queen 2, the doctors know most about this than Queen 1. Because most of the case is breast cancer and vascular Dr. Ben. Then they know who to refer. So they know they refer to me after he got discharged. And he said, if I have known, I will have my much better. Let me see, I check whether got. The recent one is the left leg is like this one already, the right leg. The flattening already. Left, only this one also becomes small. And the wound is now here around this one. Small already, and it's very superficial, not so deep. That is, if you see the time frame is almost 3 months, but treatment wise is, if I count it as daily, is about 24-25 days. This is not due to cancer, no lymph nodes removed. This is due to vascular and because of capacity. And this is my patient. Actually, this patient passed away, I think, in last year. She knows she has breast cancer, but some of them, they don't want treatment. And then the whole body, even though it's the right side, the whole body is swollen, except the right hand. Is different from the, I say, kind of, if the right side, you don't go to the left hand. And her primary concern is not to reduce the swelling of the arm. She wants the swelling reduced, not also reduced in the rolling, but she wants to walk. This is, after how many times? This is after, I think, 3 sessions only. This one becomes swollen. If you compare with this, yes. And she can, after my second, if you want the slide also, I can put it down. And after 2 sessions, she able to walk from her bedroom to the, she live in the apartment, and she able to come down, first floor, come down, because she still go ongoing treatment. But now, of course, this patient already passed away. How long is this patient? For lower limb, with bandaging, 2 hours. Upper limb, 1.5 hours. It depends the severity lah. But for me, I mix the cases, light cases and severe cases, so that I can do more lah. So if I have no meeting and no going for courses or any other business, maximum I can take 8 patients per day. Minimum 4 treatments to do it. No, I just need a bed, towel, sarong, pillow, and then of course the bandages lah. And sometimes when the patient's bothered, they will bring them out lah, bring them down. This is the stages lah. Stage 0 is latency phase. Like I say, they feel heavy, they feel tight, you cannot see. But when you measure it more than 2 cm compared to the other side, then there's some sort of lymphedema going on, swelling going on. But you need to ask the patient whether they are right-hander or left-hander. Because if they are right-hander and the swelling is at right side, it should be bigger than the left side, about 3, like that. But if they are left-hander or right-hander, but the swelling is the left hand, obviously it is 2 cm, there is some swelling occurring up. Mild, the first one is a slight swelling. You can see there's swelling, but by one glance you will not able to see. But when you compare it, you can see it's reversible, can go back to the normal. But if the second and third stage, like just now you see the severe one, it can never go back to the like normal, but it can be reduced swelling. But I'm seeing that just now I show you the first case and the swelling in the both leg, right? But I'm seeing like I think the patient can go back to normal side because the right side now is getting smaller and smaller. And this is the obvious one. You can see the stages lah. Stage 0, pre-stage, stage 1, stage 2, stage 3. If you're not well versed, you will not know that there's swelling. But if you really look at it, you can notice a bit swollen. But if you like one glance, you will not notice it. You will not notice the swelling. Like because like us, physio kan we biasa sudah tengok kan. By one glance we know oh swelling. Even without measuring, we know already there's some swelling going on. Of course, the stage 1, stage 2, stage 3 is obvious lah. You can see already. Classification. Besides the stages, there are classification also. There are 3 types of classification: primary, secondary, and filariasis. And recently, there are the HQ already launched a program under Kesihatan for elimination of filariasis. A patient with filariasis are referred to us for lymphatic massage. Filariasis definitely you know is due to lymphatic system. Primary is congenital malformation of the lymphatic system. Means the child or the person, when they are in the womb, their lymphatic system are either the lymph nodes or the vessel are malformed in some way. When they are straight away born, you can see the swelling, whether it's the neck, the hand, or the limb. But some is when they are teenager stage or when they are 35 years old, then the swelling come on. Suddenly, that the injured vessel, they have the swelling. And of course, the secondary is due to damage to the lymphatic vessels or lymph nodes. Damage instance in terms of lymphatic nodes are being infiltrated by cancer, or the lymphatic nodes being removed, or when the surgery they done like breast mastectomy, they have maybe disturbed. So the lymphatic vessels is damaged. But not all will breast cancer or cervical cancer patients develop lymphedema. Maybe those who develop is about 30-40%. This is the primary one. This one is called cystic hygroma. But mostly if like children, they have this lymphedema. Usually they are associated with some syndrome. Like they are trisomy syndrome, like the Evers syndrome, Down syndrome. But some also like cystic hygroma. No, it just happens to be the lymphatic system at the neck. It can develop until the end. And whether surgery can correct it, it can come back. So because we have one patient abdomen. The doctor removed it. After that, and it's very hard for us to bandage it because the private part also swollen. Because she's a girl, how do we bandage it? We can bandage it, but when she go to school, now she unbandaged when she wants to be. But for a boy, it's easier for the bandaging to occur. of lymphedema in the lower limb, their foot are not swollen. It's just only the legs and the buttock. And you will see like they are wearing, you know, the swelling like as if they are wearing a trousers. Like they're wearing a bodysuit. What? When it is not, like this you can see the swelling is equal, same. But you can see the staining. This is definitely a vascular problem, but can be done with MLA. Secondary, as you know, is common lah. Yes, if it's over time is not treated properly. What to do? I got patient, like just now the patient came to me. The few years ago, the doctor said amputation. But he said, even though my leg is broke, I don't want amputation. I can still walk. If I amputate, I'll be sitting on a wheelchair forever or with a prosthesis. What to do? Is a complete congestive therapy consists of 5 things. Manual lymphatic drainage, that's a massage, compression bandaging, exercise, self-care, and skin care. The skin care are more like what you do for a diabetic patient, but it's more, they are more aware, much more aware of it. Like diabetic, maybe the wound they got will be a bit slow to heal, but it will heal. But for lymphedema, because the fluid is protein high, even a little bit wound is where infection can set in and become cellulitis. That's why it's more, the skin care is more, have to be more careful than a diabetic patient. Okay, this is what I say lah. Consists of 5 lah. But the manual lymphatic drainage also, that this complete decongestion got 2 phases. First phase is they come to us daily for 2 weeks, but for that uncle, I asked him to come for 1 month, every day, except Saturday and Sunday, and follow with all the other compression, exercise, and self-training lah. After the phase 1 is the self-care. When their swelling already become static, means can no more go further down, and it doesn't, the next 1 week it doesn't come, or 1 week it don't do, also it come back. So we ask them to do themselves at home. Instead of bandaging the 22 hours per day, in morning they use the compression garment, nighttime they the compression bandage, and all the others MLD as needed. When they feel slightly like coming swollen a bit, they come to us, make the appointment again, come to us, we do the open channel again, and then subsequent follow-up visit. This water technique is a gentle therapy, you will feel it lah. This is what we do, how we channel it from this picture. But the opening channel is a must, is the neck, the abdomen, and the breathing. That is a must. It's the standard. If it's upper limb, means the leg, the hand, arms, the opposite channels have to be open. If the lower limb is the same side, the groin and the armpit. From up, from if the arm, we open after the open channel, it will be arm, then forearm, and then the hand. But if only the leg, it will be, you have to channel it up, then the thigh, and the lower limb, and and then the food. Usually, what they will feel is if they become hard, with the wrist massage, it will break up the fibrosis. Sometimes when the fibrosis become break up, you will see the lip a bit bigger, but it's softer. But after another few times, it will become smaller again. And I usually tell my patient to observe this generally when I do that, what they will feel. One thing is they will sleep very well that day. Of course, they will go to urinate a lot, but doesn't mean they don't drink. If they will ask you, unless they have heart and kidney problem lah, they don't have these two issues. They will ask you, with this swelling, will I drink more water? Will it become swollen? No, it will not. They have to drink water. If not, the skin will be dry and then will be thirsty. They feel. Then some of them feel thirsty after the treatment. Some feel very drowsy after the treatment. And for those who have some bowel problem, they go BO very well with the deep abdominal massage. And some will feel, because of the opening of the channel, the flow of the lymphatic fluid is there. That's why they feel itchy. What they do is ask them to put lotion. And some, even when I was doing the therapy, they can feel like ants crawling up or like fluid going up when the channel is open. And that means it's good. That means the lymphatic vessel is better. This is out. This is the bandages we use. This bandage is different from the normal bandage you get from the pharmacy, which you use for ankle swelling or sprain. The bandages that you use for sport injury or some injury, sprain and strain is a long stretch bandage. But these bandages are short stretch bandage where is when you rest, it doesn't give compression. But when they move, they will feel like micro massage. That's why we give this bandage to a continuation of our massage, so that it continuously to help to break down the hardening of the tissue and also to continuously massage the limb so that we go, so it's faster. It's very few layer. First is like a stocking. Then we use a Rosida soft or Rosida malleolus. We bandage. Even the fingers is not swollen, we still bandage to prevent that swelling go down there. And then lastly, the bandages. And it can be, it depends on how, if you ask me how many bandages you use, I cannot give you offhand because I have to see how big is the limb, how big is the swelling is. It can be up to 17 to 20 bandages, various size, from size 4 to size 12. So this is indication, the contraindication. Got people ask, can I use the pump? Yes and no. Yes, if they have gone through a series of manual lymphatic drainage. Because if they start come to you, first time come to you and you put on the pump, sure it will go down. But after 2-3 hours it will come back again. And it will not reduce like what I do with my manual lymphatic drainage. It will come out but it will go back again. Because the pump will be just only here only. Because it doesn't bring it away. So with manual lymphatic drainage and this pump, if they buy themselves, they can, maybe they cannot do on themselves, but people can put it on, but they still ongoing with us. It's good. It helps in a sense. It's effect is the same. But last time, because nowadays the pump, they give the massage pressure is below the cuff, the BP set punya cuff punya pressure, because the BP set can go up to 200 cut. Because the pressure of the lymphatic capillary will be damaged will be more than 65 milligram. Once the lymphatic capillaries are damaged, it cannot regenerate. So it will be more trouble again. Of course, exercise with the bandages on, because as I say, it's a short stretch bandage. The more you move, the more they feel the compression. We use machine also to do exercise, and then some of the exercises that I teach my patient for those after post mastectomy, it's not the right after surgery. The first week of surgery, the exercise is very light. If you give them this type of exercise, they will develop seroma, and seroma will develop they will develop frozen shoulder, they will develop lymphedema. This is for low limb. We got strengthening using weights, dumbbell, light dumbbell, and what hydrotherapy is good. Hydrotherapy is good because the water buoyancy, and at the same time when you go against it, strengthen. So people with pain.
Could you go back to the lymph exercise so that I can take a quick picture, please? Thank you. The lymph.
I think I will share the slide with all.
Oh, okay. Wow. Okay. Thank you.
And if you have time, you can come to my department. I can give you the pamphlet.
Thank you.
This is this high so that you can do the upper limb. It's actually the best type of exercise because it gives you deep breathing. When you're in the water, you want to breathe, kan? Cannot. The pressure comes from the water, so you have to. It's very good actually. And if you are staying in the condominium, of course some condominium got swimming pool like even better lah. But if you like landed land, you have to go somewhere lah, unless your place got your landed land got swimming pool lah. Seawater excellent medium for aquatic therapy, but the salt in water increase because the salt increase the water in water buoyancy. And also the salt kills bacteria, but you must be cautious because as you know the beach got all the sand flies and it bites, you know, for lymphedema, mosquito bite, ants bite. If they see already, they have to immediately treat it. If not, you get of infection and similar like this. This is when you're under pressure, like how much pressure it is lah. Apply lotion. Of course, the lotion there is and hypoallergenic that here. But there, if they are not allergic, they can use any lotion or baby oil or whatever. But if they are allergic, but the one that is very good is Lucina, right? Eucerin, this one. That is the one that's used to be, that's the one that they use now lah, before they put bandage. But I usually don't put any bandage. When I do massage, no powder, no oil. Why I no powder, no oil? Because I want not only the skin contact, the friction. When I do, it's not like this. It's very smart. It's the traction between my skin, my pressure from my hand to the skin by pulling. So as you know, it's just under the skin, the lymphatic vessel, just pulling. It's slight pressure and the pulling. Does help. So you do not use gloves, do you? Gloves, when like that case just now. Like if it's no wounds, nothing, I don't use gloves. Unless I have cuts and the patient also have wound, then I use gloves. But because the glove also not got give friction, it's quite okay lah. Not the plastic glove lah. Because if you just glide, if you use oil or powder, then you just glide over it. There's no traction. You want the traction of the skin. And if there's any cut or if the skin is too dry, seek the doctor help lah. Get the proper oil or lotion lah. And sometimes they give hydrocortisone also lah. Hydrocortisone is a steroid, so must see a doctor to get it lah. Whether it's useful or not. Must keep clean and dry. Attention when you're cutting the nail, don't cut until the cuticle, until you bleed. Protect exposed skin with sunscreen and insect repellent. Because I noticed the patient, the swelling will become worse during the dry season because weather hot. And also if they're exposed to sun, and then if they bath, the temperature of the no soaking in the bath or go sauna because the temperature can be very hot, it can make the swelling more. Because as you know, when you go to a hot sauna or a hot bath, your blood vessel dilate. So when it dilate, more fluid come out. Your lymph already swollen. So when more fluid come out to the tissue, it's a bit more difficult to absorb that. All these are like what you tell your diabetic patient. The red flag is when they feel some redness of the swollen area, they feel heavy, discomfort, they feel like they're having food. This is the self-care. How we taught them to do the manual lymphatic drainage, how to do compression, bandage and compression. Avoid immerse in 102 degree Fahrenheit, 38 degrees Celsius. Avoid the swollen limb. Tell them not to wear watches, bangles, or rings or anything, because when we don't know, suddenly it becomes swollen, you cannot take already. It becomes tourniquet effect. This is another kinesio technique. It's a spot taping that we cut it until like a spider. This end you put it near where the needles is, and then the other end is where the swelling is. This is I use this to illustrate the bruise. You see this bruise is very dark. After using it, it becomes lighter. It helps to drain also the swelling. There's no special diet. There's no effect of low protein diet or increased weight intake. But of course, as usual, weight control lah. If they are diabetic, of course, you ask them not to the diabetic diet lah. If they hypertension diet lah. They must increase their fluid intake after the therapy. If not, they will have migraine or dehydration. When does it significant malignant lymphedema? Means the cancer come back. Because I have done patients who have been on bleeding for a long time. They were supposed to be just come for maintenance. Suddenly I said, how come become swollen again? At first I'm not so in the beginning I don't know. But after a while I know something is going on. So I asked them to go back to see the doctor. If not check the CI marker, go back to see the doctor. And sure enough, cancer had come back. And artificial lymphedema self-induced. This I don't know in Malaysia got or not lah. But in the US and in the Western country, medical insurance, you can claim medical insurance. They tie until it becomes swollen. Because in European and America, lymphedema therapy medical insurance cover. But Malaysia, I don't think so. So that usually the patient that comes for the private center, they claim under physiotherapy, even in the hospital. But in America, I know lah because our seafood is from America, so it's memang like lymphedema therapy treatment can be claimed by medical insurance. And all this lah, lack of compliance means that today they come, after that they are missing in action, they come back again. Of course, there's no continuation. Recurrent cancer, as I said, associated illness like suddenly they have cardiac problem or kidney problem, and this diagnosis, like just now the guy. The swelling, stage 3 cervical cancer, I see in October, let's meet in 2 weeks.
They can go back to their normal size.
Yes. And to help them to reach the optimal mobility, strength, independence. And for palliative, it's their quality of life. And how to, from this stage of their life, stage 4, let's say, to the other. Like a lot of physiotherapy treatment is contraindication for pediatric cases, like chest physiotherapy. But throughout my experience, when they have lung cancer, we're not supposed to do percussion, not supposed to do vibration because bleeding left. But I have done this young guy after I do cough up the phlegm. Of course, it's not fresh blood come out lah. The got phlegm, but it's streak of blood, not many. You see, he said he feel better in terms he can sleep and also he can breathe easy. So it's, as we say in pediatric care, between two evils, which is better?
All the things.
Yeah. So any question? This is Professor Ethel Fieldy, the founder of Fieldy. And she's 21, 22, 2008. Their clinic is like is hospital for inpatient also. Is actually the place is a hotel before. They buy over and over it. And then the patient come over for 4 weeks. If do morning, afternoon for 4 weeks. Saturday, Sunday. Saturday, Sunday no, but Monday no. And the place that it is like a village that is like for tourists. Like
In where?
Hintergarten in the Black Forest area, southern Germany.
We went there also to make the case.
Any question? Yes.
Lymphedema easy to diagnose? Like, do you need a specialist or can any doctor just say?
If they know, then you can diagnose it.
Or is it always just associated with cancer patients?
Huh?
Is it always associated with cancer patients?
Here they always refer with cancer patient, but usually like you have no cancer, it's a bit difficult to diagnose. But if the doctor knows about lymphedema, they can just any swelling after they test it like normal test, that was any swelling, they cannot find anything, they can refer to me.
Is it like what the Chinese always say, elephant legs?
Yes, elephant
Like if
size.
they're not sick,